Noticed your penis developing a curve that wasn't there before? This isn't normal aging. It's inflammation-induced structural changes most men never connect to their prostate. And there's a natural approach addressing the inflammatory cause mechanically. Here's what's creating this curvature. Your prostate, when chronically inflamed, releases inflammatory signals that trigger fibrotic changes in surrounding erectile tissue. This abnormal tissue formation creates internal pulling forces that bend the structure progressively. The curve you're seeing externally reflects internal scar-like tissue, developing unevenly. Natural compounds exist that reduce inflammation while supporting healthy tissue repair. More on those in a moment. First, here's the exact process, creating structural deformity. Think of erectile tissue like a rope made of many flexible fibers. When healthy, the rope bends smoothly in all directions, without permanent deformity. But when chronic inflammation occurs, some fibers get replaced with stiff scar-like tissue, like replacing rubber bands with metal wires in parts of the rope. These rigid sections can't expand normally during erection. The flexible tissue around them expands fully, but the scarred tissue stays short. This uneven expansion creates bending. The structure curves away from the scarred side because that side physically can't lengthen as much. With prostate inflammation, this scarring typically occurs on one side more than the other, creating progressive visible curvature. Here's how this structural change develops over time. Stage 1, months 1 to 6. Very slight curve, barely noticeable. Maybe 5 to 10 degrees. You might notice during erection, but dismiss it as angle or lighting. Fibrosis is just beginning. Stage 2, months 6 to 12. Curve becoming obvious, 15 to 30 degrees. Clearly visible and may affect positioning during intimacy. Scar tissue is accumulating. Stage 3, months 12 to 24. Significant curve, 30 to 45 degrees or more. Definitely impacts function and may cause discomfort. Extensive fibrosis has developed. Stage 4, beyond 24 months. Severe curvature, potentially causing pain during erection. May make intimacy difficult or impossible in certain positions. Fibrotic tissue has replaced substantial portions of normal elastic tissue. Most men try approaches that can't reverse existing structural changes, ignoring it, hoping it stops. Fibrosis is progressive while inflammation continues. The curve worsens monthly, not stabilizes. Manual stretching or devices can't break down internal scar tissue. You might temporarily straighten externally, but the fibrotic tissue inside remains. Some devices can actually worsen inflammation and accelerate scarring. Topical treatments can't penetrate deeply enough to reach the internal fibrotic tissue, causing curvature. The problem is structural, not superficial. Waiting for medical intervention by the time curvature is severe enough to seek medical procedures. Significant, permanent tissue damage has occurred. Earlier intervention when fibrosis is mild offers much better outcomes. So what actually addresses inflammation-induced structural changes? The approach requires 3 simultaneous components. Component 1, aggressively reducing systemic inflammation. This stops new fibrotic tissue from forming. The inflammatory signals triggering abnormal tissue replacement must be comprehensively suppressed. Component 2, supporting normal tissue repair mechanisms. Even while stopping new damage, you need to support the body's natural processes for replacing damaged tissue with healthy elastic tissue. Component 3, enhancing circulation to affected areas. Better blood flow delivers nutrients needed for tissue repair and removes inflammatory byproducts that promote fibrosis. Research tracking. Men who addressed all 3 components show specific patterns. 8 to 12 weeks, curvature. Progression stops. Existing curve remains but doesn't worsen. Inflammatory process is being controlled. 16 to 24 weeks. Some improvement in curve severity, perhaps 5 to 10 degree reduction, as some fibrotic tissue is gradually replaced. 6 to 12 months. Maximum structural improvement achieved. Mild curvature may improve 20 to 30%. Moderate to severe curvature typically improves 10 to 20%. Complete reversal of established fibrosis is unlikely, which is why earlier intervention matters enormously. 3 factors significantly accelerate fibrotic tissue formation. Continued inflammatory triggers. Each inflammatory spike promotes more abnormal tissue formation. Common triggers include alcohol, processed meats, extended sitting. Every exposure compounds the scarring. Inadequate tissue oxygenation. Poor circulation during the inflammatory process means tissue repairs abnormally. Areas with insufficient oxygen develop more fibrosis during healing. Repeated microtrauma. Vigorous activity during the fibrotic phase can cause small tears in the forming tissue. These tears heal with even more scar tissue, accelerating structural deformity. Avoiding these while addressing root inflammation gives tissue the best environment for healthy repair rather than fibrotic scarring. The critical window is early intervention. When curvature first appears, 5 to 15 degrees, fibrotic tissue is still minimal. Aggressive inflammation reduction can stop progression completely and potentially reverse most changes. Once curvature exceeds 30 degrees, substantial fibrosis has occurred. You can stop further worsening and achieve modest improvement, but complete structural reversal becomes unlikely. The tissue that's been replaced with scar-like material stays largely permanent. This creates urgency to address even mild curvature immediately, rather than waiting to see if it worsens. For men exploring natural approaches to address inflammation-induced structural changes, there's a formulation combining all 3 components discussed: systemic inflammation reduction, tissue repair support, and circulation enhancement. It's designed specifically for this fibrotic pattern triggered by chronic prostatic inflammation. The link in description provides detailed information about the ingredients, research behind each component, and how they work together to stop progression and support whatever structural recovery remains possible. This is educational content. Always consult healthcare providers for medical guidance, particularly regarding structural changes. Have you noticed any degree of curvature developing? How long has it been present, and has it worsened over time? Sharing your experience helps other men recognize this is inflammation-induced fibrosis from prostate issues, not inevitable aging. The link for natural anti-fibrotic approach is in description below.